First of all, thank you guys for joining us. And this campaign, we're joining a national campaign called Fight the Fall. And it was started by the National Council on Aging to basically create awareness and educate people on the risk of falling in the elderly. And so we wanted to join part of that campaign here at Physical Therapy and Balance Center in Germantown. And so we're really proud to do this presentation. From a personal note, this campaign means a lot to me, a great deal to me, because I saw this firsthand, what a fall can do with my own grandmother. So I was in college when my grandmother started to suffer falls, and I saw firsthand how that affected her. And if I knew what we know now back then, I think we could have done a lot to help her. Physical therapy has a big role to play in helping prevent and also treat patients who are falling. So again, the campaign is called Fight the Fall, and that's also the name of our presentation. And I want to start off with a few statistics. And these statistics are not to create any fear in anyone, but it's just basically showing the scope and how big this problem is. And we know that falls are preventable. And so if I can, with the statistics, show how big of a problem this is, I hope that can help. Every year, 33 to 35% of older adults, so aged over 65, fall. So that's 1 in 3. And if you're over the age of 75, you have a 40% likelihood of falling in the community. So falls affect mobility and quality of life, mostly because when you fall, you injure yourself. So your ability to walk afterwards may be affected. Your ability to do common errands may be affected as well. Just another statistic right there is of all falls, 30% have led to a hip fracture. So we know fractures of hips is a main injury point. Falls are also the main cause of injury in older adults, and 95% of hip fractures are from falls. So when we see a hip fracture, most likely than not, it was because of a fall. 40% of nursing home admissions are related to falls. So a lot of times, if you fall, the home environment may be too dangerous for you to stay, or you don't have the support and help, and therefore a lot of folks end up in the nursing home. More statistics. So seniors, folks over the age of 65, have 9 times more fall-related injuries than younger folks. Most fractures are caused by falls. We talked about that before with the hips. An older adult is treated in an emergency department for fall-related injury every 15 seconds. So every 15 seconds, somewhere in the U.S., an emergency department has a patient come in because of a fall. And then an older adult dies from a fall every 29 seconds in the U.S. So all of this to say is that falls are a huge problem. It's a major cause of injury in our seniors, in our patients who are over 65. And so we wanted to address that and give you just how much of a problem that is in the U.S. So let's talk about balance. So in order to prevent falls, we need to have balance. So let's talk about what is balance, how do we attain it, and how do we maintain it. So in a nutshell, balance is a state of equilibrium in your body, okay? So your body has sensory systems that are constantly telling the brain information, where you are in space and other things. And then the brain sends signals to your legs to react. So if you're starting to trip or fall, your sensory systems are telling your brain, hey, I'm falling or I'm tripping, and the brain reacts to that and tries to keep you upright. There's 3 sensory systems that are involved with the balance. The first one is the visual system, so your eyes. So we highly recommend you get annual eye checks. So your visual system, a lot of us rely heavily on our eyes to keep balance. Another thing called the somatosensory system. We'll go a little bit deeper into that. That's just our joints and muscles. And then our vestibular system is part of our inner ear. So let's go over what's called somatosensory system. In other words, your joints and muscles and nerves in your body. They detect touch and something called proprioception. So where you are in space, that's what proprioception is. And so knowing where you are in space. So if you were to close your eyes right now, your ankle proprioceptors are telling your brain where it is in space. I am in a bent position. Your body is telling the brain, oh, I have socks on perhaps, or my shoes are on me. And so it's receiving information, the brain is receiving information from your somatosensory constantly. So that comes from our joints and from our muscles and skin. So disorders that affect somatosensory is neuropathy, joint replacement. So when you have a joint replacement, your nerves in your joints are no longer there because you have a new joint. After a stroke, and vascular problems. So if you have diabetes, for instance, you're going to have most likely sensation and proprioception loss. That's one condition that would cause this. The second system is called the visual system, so your vision in essence. So your eyes tell you where you are, and it levels you to horizon. So your eyes will tell you how to level you. So if you wear glasses or contacts, making sure that you get them checked every year, making sure that you wear glasses and contacts and or contacts when you go out. Disorders that affect vision would be macular degeneration, glaucoma, and cataracts. So that's really something that you would need to be vigilant about every year, making sure that you see your doctor and optometrist for. And then your vestibular system, it's located in the inner ear. It's a small organ, but it tells you where your head is in space. So if you were to nod your head up and down like you're saying yes, your vestibular system is telling your brain that it is going up and down. If you were to turn your head like you're saying no, your vestibular system is also detecting that. So basically, wherever your head is and moving in space, your vestibular system is detecting that. So disorders of the vestibular system, the most common one is benign paroxysmal positional vertigo, also known as BPPV. That is where the canals that are part of the vestibular organ, they get flooded with small little crystals. These crystals can play tricks on the nerves, and you think you're moving when you're really not. So you get terrible vertigo. So it's a spinning sensation. So if you've ever had the room spin on you, that is what we call vertigo. You can have vestibular migraines, vestibular neuritis, and there's also something called Meniere's disease. So how they all work. So all three sensory systems take information and send it to your brain. So your brain receives information from the somatosensory. Like I said, if you were to close your eyes, your knees and ankles and toes and hips, they're communicating to your brain right now. The vestibular system's telling your brain where it is in space, the head. So if your head is tilted to the right, the vestibular system is telling you that. And then your vision, as you're looking at your screen, as you're looking at this presentation, your vision is telling you where you are to horizon, in relation to horizon. And then your brain sends signals back down to the legs and feet to adjust. So the processing of the brain is very critical. So the information comes up to the brain, and how does your brain process? So processing of the information must occur for proper output. So the brain then tells the legs what to do. So there's disorders that can affect processing. So dementia, stroke, concussions, or traumatic brain injuries can affect how your brain takes these informations and processes them properly. And then after the brain processes it, it sends motor output. In other words, it communicates back to the legs a strategy on how to stay upright. So there's three main strategies. The first one's called an ankle strategy. So when you have a little trip, your ankles will grab, or they'll flex and they'll move to try to keep you upright. So if you have a small stumble, your ankles are going to really try to keep you upright. If it's beyond the ability of the ankles, then the hips get involved. So you'll kick your hips out to gain your balance. Much like if you're on a balance beam and you're falling to the side, your hips will kick out towards that side to get you back into upright. And if finally all that fails, a stepping strategy is taken where you take a step over. So if you're walking in a straight line and your ankle is trying to keep you upright, it's not good enough, the hips will get involved. If the hips aren't going to keep you upright, you'll actually take a step. And that's how your legs balance you, keep you upright. So how can physical therapy and balance center help you? So what we do first, it starts with testing, assessment. We test the 3 sensory systems: your eyes, your somatosensory, and your vestibular. And then we look at the vestibular system. We look at your gait. Your gait is how you walk or your movement pattern. We can also see if there's latency, meaning if your brain is able to quickly tell the legs what to do to regain balance. And then we strength test, and we look at your core and legs, lower extremities. And then finally, we design a program that is right for you. So we try to design a plan of care, as we call it, to address the deficits. So if you have a strength deficit, well, we'll have to address that. If you have a vestibular deficit, we'll have to address that as well. So depending on how you present, we will create a plan of care for you. So how do you help yourself? Well, come and see us if you've had a fall or you feel like you're at risk for fall. If you are having an annual checkup with your physician, bring it up. Make a note to bring it up with your doctor and talk to them about a referral to physical therapy if you feel like you have a concern. And then thirdly, you can take care of your environment. Make sure that you throw away rugs or fall hazards or tripping hazards around the home. Being really vigilant about creating an environment around the home where you won't trip on things. And then use night lights, so when you do go to the bathroom at night or you get up late at night, in the middle of the night, you can see where you're going. And then some of us may have dizziness when we first get up. So sit on the side of the bed for a little bit before getting up and walking. And then use handrails in showers, bathrooms for safety. So there's a lot of folks who are staying home as we age, and so we can do that by putting in rails in the bathroom and shower, and there are obviously contractors who do that kind of work. So you can create a home environment that's very safe for yourself. And the other thing you're doing is already being on this call is you're educating yourself and learning more about balance. Okay, further, exercise regularly. Keeping your muscles and bones strong and healthy will help a great deal. Exercise and movement helps your proprioception, which is also your somatosensory. We talked about that earlier. Your joints and muscles stay in tune. Also challenges the vestibular. So exercise is a huge thing to help you stay balanced and prevent falling. And then if you do have falls or you have a risk of falling, a medically based fitness program coming in for physical therapy would be the key as well. So we can specialize in Parkinson's and balance and cardiac training and other chronic diseases. So if you have other conditions that cause you to fall, well, certainly physical therapy using a medically based fitness program can help you. Okay. Just a quick thing on insurance. Physical therapy is covered by insurance. If you have Medicare Part B, you're going to be able to come in to see us as an outpatient physical therapy patient. Just one thing for Medicare, you do need to have a physician prescribe or refer you. So basically, the doctor has to write that physical therapy is necessary. So, and that's really easy to get. It's not that challenging. We can get a prescription from your doctor. Okay. And lastly, I would like you to take us up on our free fall risk assessment. We're giving out away free fall risk assessments, which will take about 15 minutes of your time in our office. And it's no obligation. We want you to just know your risks and let us assess you. That's our presentation in a nutshell. We really want just falling. It can be prevented. And if you have any questions, please call us, 301-235-3031. We'd love to speak with you and give you a free fall risk assessment and let us know how we can be of service.